There wouldn't have been a deal without Robin. Simple as that. It's true.
Though there definitely wouldn't have been a deal without Donna. So I suppose I'm a consultant, really. My background is anthropology. But when I first started working with Wigan, ages and ages ago now, I ran a research company and I was doing research, and we kicked off some original transformation plans by doing some ethnographic research, and there's a kind of organic trail to where I am now. As part of that research, we trained some frontline workers, including social workers, and I remember the director of adult social care in Wigan sort of said, "What have you done to my frontline?" In a good way. And it sort of all sprung from there. So we all started working on how we would roll this training out and what it would mean in the back end. And I remember thinking at the time, this isn't going to go anywhere. I actually tried something very similar in Kent about 5 years before, and sort of had my fingers burned with people losing interest very quickly on a project. And then Donna came on board, and I just remember being in meetings and instructions coming in from Donna, who was in another room on another meeting, and being absolutely amazed at how fast things were going. But since then, since the whole deal story and the way it's rolled out, and I ended up in Wigan for a long time doing a lot of training, I've since gone to many other councils who, I think it would be fair to say they're all trying to replicate what Wigan did, and some of them have got further down that line than others. Some, I think, will never get off that line until they're kind of forced to. But I continue to work with other councils, and it's been really interesting working. So in Wigan, the driving force was adult social care originally, and Donna taking that on and moving it council-wide. But it's been really interesting trying to restart the same kinds of processes in different parts of the council. So it hasn't always been adult social care. I do a lot of work with public health, which is it's a good place to start it. But it's interesting. They're not as, how can I put it? They're not as close to power as adult social care is. I think that was an important part. But it's been really interesting, and we can talk more about that, I think. I mean, I was, partly I was young in Kent, so there's a level of authority that comes with that. But I remember, before I had any involvement with Wigan, I'd done two projects, one in Kent and one in Knowsley, actually. And I'd written this book with a friend of mine, and we wrote it very, very quickly, called Just Coping, about families living just on the edge of poverty, if you like. And when we were doing that work, we were working with what was actually a very innovative lab in Kent. It was called Silk. I think it may still exist in some form, but the Social Innovation Lab in Kent, which funnily enough was replicated in Knowsley and had exactly the same name because they're also beginning with a K. And there were these processes. There was a lot to do with service design thinking. And I was around in the early days of all that rolling out because they used ethnographers, and I'm an ethnographer. And I remember talking about using ethnographic methods then, not just as an outside, I was sort of saying, don't just get outside consultants to do this, but actually introduce some of these principles into frontline practice. And I think what happened in Kent, it's not that it was all well intentioned. There was no sort of failure, if you like, but it was housed inside a project. So it was housed inside this social innovation lab in Kent, and that's just where it stayed. And then when the social innovation lab in Kent kind of fell, not out of favour, but just sort of stopped being, had as much notice taken of it, all those kinds of efforts disappeared with it. And it stayed within a kind of project service design model. So it didn't move out wider into the council. I mean, I say fail. Actually, I guess now I look back on it, it's part of a process, right? I was learning too. I was young, and maybe naively going, why can't people see that this is a great way of doing things? And like I said, by the time I got to Wigan, I just assumed it would all be the same because I'd had that experience before, that we were housed inside a project. And Nesta, rightly or wrongly, has a bit of reputation for funding projects that start and end. So I sort of saw it all in that context. And in fact, if it had stayed with the original chief exec in Wigan, it might not have gone anywhere. I mean, the chief exec changed obviously to Donna, and so that changed things. Yeah, it could easily have been a project. It just happened that there was some well, I would say people picked up what I had originally thought of and ran with it far.
There was something magic, wasn't there, about that time? And even seeing you now on the call, like, it kind of reminds me of the energy and the kind of excitement that there was in Wigan at the time. Where did that come from, Robin?
Well, I mean, for my part, that excitement came personally from having such a kind of dynamic set of people to work with, people who were responding. And you know, people have asked me in other places. They've always said, you know, how do you get that atmosphere of change? And I'm like, oh, if you have to try too hard, you're probably doing it wrong. And when I talk about the excitement from my side, I mean, I remember coming up and saying, you know, we really need to get something really simple, like a list of all the activities that are going on that I couldn't see because I'm from London, right? So I couldn't see what was going on while I was away, and I would get that list like the next day. I mean, normally those kinds of things can take hours and days and require approval and sign off, but I would get them the next day. And that idea that things were happening and people wanted to be part of what was happening was infectious, I think. And I remember, you know, some of the very early people involved, and these are names you'll know, but people like Catherine Anthon, who was a social worker, just infectious energy. And she was involved very early in the piece. And I think people caught on to that idea that if you were going to do things, try things, work hard, that you were going to get recognized for that and rewarded. So yeah, that lots of energy, you're right.
I think Catherine was amazing. She's still there doing amazing things. And I think it only takes a few people like that, doesn't it, within a team or within an organisation to kind of, I've always called them the spark plugs. You know, people who you just need a bit of ignition maybe, or not even need that, and then they just, you know, and it spreads, and it brings about such a, I don't know, a can-do type culture and a sense of possibility. So tell us a bit more about how Wigan, without naming names, but how Wigan compares to other places that you tried to do this really good stuff.
So I think, I mean, part of the problem is that Wigan was so successful that I think that other places have sort of wanted to buy a bottled version of whatever the secret sauce is. And, you know, I have been asked over the course of the last 5-6 years to come and deliver that training you delivered, and somehow wholesale system transformation will happen on the other side of that. And I have to have these very awkward conversations where I say, look, the training was just one part of everything that went on, and yes, the training works, but it worked within a context, a context of change. And I think that is the single biggest blocker elsewhere, is that they want a viable process that costs X number of pounds, and out the other side you get this whole system, whole culture change. And I think even the best kind of processes require more than that. There's got to be a bit of organic stuff that goes along alongside it, and that needs all that enthusiasm that we've just talked about. And critically, I think it needs senior leadership buy-in. And often I'm brought in by people who are absolutely have that motivation, but they don't have the ultimate say-so when it comes to making big decisions. So I think that, yeah, senior leadership buy-in is a big deal, and it can't just be about, I'll sign off this budget to get Robin in to do the training. It's got to be more. I mean, one of the questions I wanted to ask you, Donna, I've always wanted to ask you this actually, is you know, when I was rolling out all that training in Wigan, and I was up, you know, weeks at a time doing it day after day, of course you were delivering trainings as well, and I, you know, other places are really shocked when I tell them that, when I say, you know, the chief exec at Wigan every single week was training the very same people that I was training, not just looking at it from far away, but meeting the exact same people, having conversations, so that when I had a conversation with them, you were then conversing with them about what I was talking about. But there became a real culture in those training workshops of people, have you been to Donna's yet? Have you been to Donna's yet? And I didn't know what was going on in Donna's workshops, but I'd love to know now how it was fitting.
I think we learned a lot from you, Robin, from the work that you did with us in schools initially, and also some work we did with Hilary Cottam in Worsley Mains with children and on the edge of care and their families. And I think we realised we had to do something radically different because what we were doing just wasn't working. And we wanted to build this different ethnographic relational model of public services, and not just do it as a project, but do it as just the way we work, 365 days a year, and not just in social care settings, but in everything: environmental teams, planning teams, lawyers. It's quite hard to get lawyers to think person and to think ethnographically, but we did these things called listening into action. I think that might be what staff were referring to, and it was very much about myself, the leader of the council, the cabinet, my management team, opening ourselves up to listening in a deep way. And not a lot of leaders like that. They find it a bit scary, and it can be scary because you get all sorts of unexpected things. But we were there to listen, but more importantly, to do something about what we'd heard and to put change into action. So we did some really remarkable things where people would suggest things in a meeting like that, and because it was the leader and me, we could decide, yeah, that's a great idea, let's just do it. So it was people enjoyed going, and we made it fun, we made it interesting, but it was all about listening and observing, and I could see, as the chief exec, you could see the movement of the organisation, you could see it shifting, you could feel it shifting, you could see that energy growing, and because it's always been a good council, Wigan, for many years, way before me, but your work and the work we did together from adult social care, making it just the way we did everything, it just made us, it just gave us that kind of huge amount of energy, didn't it? Because we were listening, and before it was more kind of paternalistic, top down, well-performing services, but this is what you'll get, and this is how citizens will be very grateful for what they're going to be given. It's that kind of doing things to people. Mm-hmm. So yeah, those sessions were brilliant, and I think they're still going on. I think Alison's still doing them now, possibly online. But they're such a powerful thing. And I don't think a lot of leaders understand the power of quietly, humbly listening. Can I ask you another question? I feel like I've got such an opportunity to ask you lots of questions now. So tell us about ethnography, and tell, for those people that don't really know what it is, just in a really simple way, explain what it is.
So ethnography, slightly misunderstood as it grows wider. It's essentially the output of anthropological research. They used to refer to ethnography when an anthropologist says an ethnography, they really mean a book. They mean the output. But it's come to mean a kind of research method, and what that research method is about immersing yourself in people's lives and taking the time to understand them in the context in which they live. So if you want to contrast with, say, market research, instead of asking someone on a survey, what did you go and buy at the shops today, and relying on their answers to be true, an ethnographer goes to the shops with somebody and sees that happening. That's kind of simple way of putting it. Of course, there's a lot more behind ethnography. And there's a reason why it exists as it does. I always say that, if you like, psychologists are studying the individual, sociologists are studying society, anthropologists are somewhere in the middle studying communities and the context in which we interact with people and what have you. And ethnography was developed as a method in order to do that. So it's about. So there's a lot of thinking behind it. It's not new. It's old. It's as old as any of the other social sciences. But it's interesting because people, we were just having a conversation before doing this about things like aspects of power, the power relationships that are constructed between citizen and state and within an organization and what have you. And funnily enough, ethnography, not by design, but by the way it works, it sort of turns you into a champion of the underdog. Because if you're learning about people's lives in great detail and trying to understand that in a very nuanced way, and I always talk about it being about seeing the world through their eyes. So if you've done ethnography as well as you can, you understand the world in the way that the other person that you're trying to understand understands the world. then obviously you become sympathetic to them. It's just the natural part of the process. So an ethnographic relationship is inherently quite an equal one, and it gives voice to those who don't normally have a voice. And I think it's interesting. I think it's those kinds of things that really caught fire in Wigan. We were starting to, and as you were saying about the listening workshops, I mean, effectively you were doing the same thing, just allowing people to speak back to you with their own thoughts, and that's the kind of practices that we were trying to instill on the front line. And obviously there's a whole set of tools that ethnographers use to try and do that. I don't think it's as simple as just saying you need to understand the other person through their eyes. There are tools and techniques that enable you to do that better, and that's essentially what the training that I do is. But the really interesting thing for me was how, once we'd realized that there was inherent value in doing that, the question became, how do you redesign a system such that is the thing that you're now doing? And you talked, Donna, about listening into action and listening and then acting. I mean, I'm always intrigued. It wasn't just the listening; it was the speed of decision making afterwards that was critical to this. And you talked about the energy, and partly that's your energy, and that ability to make decisions really, really quickly, which I haven't encountered elsewhere.
I know we didn't have any money and we didn't have any time, so we had to do something which was, and we did this thing around trying to create more of a feeling of being a cheerleader for system change and being, tapping into the energy of people, and because most people don't want to become a public servant just to tick boxes or hide behind the clipboard. They want to go and help people and listen to them understand the reality of their lives. But we've lost something in translation, haven't we, over the evolution of public services in the last 20 odd years. We've become much more silo based and process focused and risk averse. And someone said to me on a call the other day, what's the point of keeping us safe if we're not happy? We've lost something about happiness in public services, haven't we? I mean, I think one of the best things you did many, but one of them was the blank mind work that you did, that you created. Can you tell us a bit more about what a blank mind is and how to get one?
Basically, it's one of these kind of ethnographic 101 kind of rules that what an ethnographer is trying to avoid is ethnocentrism, which is where the idea that you impose your worldview on other people's understanding of the world. So it's a bit like anthropomorphism when kids turn animals into people. You're trying to avoid that as an ethnographer. And so I came up with this idea that there were a set of tools that you could do that would allow you to enter any situation, particularly a frontline service situation, without any assumptions, with the only assumption being that you don't know yet what's important to the other person. Rather than assuming that you have the right questions to hand, actually you're waiting to find out what's important to the other people. In order to do that, you have to have a kind of tabula rasa, blank mind, to do that. And like I said, I always use the term ethnocentrism, and there are tools in the anthropological toolbox to help you reach that point of not being ethnocentric. And that the director of adult social care called it, what he's like, that's like having a blank mind. I'm like, yeah, okay. And that's how it became the blank mind, and has been used ever since. And now I call it the blank mind. But yeah, it's essentially this idea about when you encounter somebody in a service situation that you are coming at it without any assumptions, and that enables you to hear better what a person's situation and worldview. It also gives the other person freedom to talk. They're not constrained by, let's say, an assessment form and a set of assessment questions, which will constrain their own thinking even about themselves. If you go in assuming that isn't enough, then people will start to talk more freely, and you'll learn a lot more. Which we get into that whole idea of what an asset-based approach actually is, and there's the kind of formalism around asset-based approaches as meaning community assets and individual skills and assets. But I always in my training talk about it's also an asset for us to know more about other people, and those things might be negative. So it's a curious kind of way of looking at the asset-based approach, but I always try and include that in my definition. being able to have a blank mind enables us to gain more assets, knowledge, effectively.
And it's quite hard to do, isn't it? In when councils have got budget cuts, or any public service has got budget cuts, because what you tend to do is reduce access to services, don't you? And you raise the threshold and you stop listening, and people just have to hit a certain bar of a threshold to get through. And then we tell people to go away, don't we? And because you're not ill enough, or unwell enough, or poor enough, or in enough deprivation yet to get to access our services. And then when you can, we'll tell you what you need. Go away and get worse, and then come back.
Yeah, actually, a very specific example of that, Donna. I was just working in another local authority, which I won't name, but effectively, I was training the frontline to think more about delivering services in the way that we've done in Wigan. And at the same time, because of budget cuts and budget pressures, and unbeknownst to me, there was a process going on that was removing the ability of these frontline workers to go to people's houses and but basically centralizing their service and asking people to come to them, which is kind of like the exact opposite of the kinds of things that I was trying to train. These two processes were going on at once. And I understand the context we live in. But yes, they may be creating problems for themselves further down the line, because obviously the most needy people will not come to the service.
One of the things that really, where I had one of my scales off the eyes moment when I was listening to you, I think we were doing something together with Manchester City Council, weren't we? And maybe about 7 or 8 years ago. And you told the story of how you kind of realised that we were getting listening wrong by when you were doing one of your interviews with a woman. I don't know whether it was in Wigan, but do you remember the story of the woman that you met, and how various professionals had just not really listened or connected with her in a meaningful way? They'd all done their little bit. Don't know if you remember that. And you went in to do an ethnographic interview with her.
Yes, though actually that story isn't from Wigan. Actually, it's from it was originally from Nottingham, and I still use that story and talking about. I mean, I'm not sure how graphically I want to explain this, but essentially this was a person who had many contacts with the local authority, multiple visits during a week, and essentially her problem had been diagnosed, if you like, that the kids were not going to school. That was why she was receiving all this care, and I went and spent, I think actually 2 days with that woman, and during the course of that time, she came to trust me. I mean, that's part of what it is that I do, and began to reveal piecemeal the various other things that were going on in her life, and from which she had kept concealed from everybody, because she thought her mission was to get her kids to school on time. And she actually thought she was doing well because the kids had started going to school, but actually her other problems were multiplying and multiplying. She had very significant health problems that nobody knew, and they were acute, acute leading to chronic. She will still be suffering from them to this day. There were abuse problems going on, and all of this she had concealed from the various people who were coming to visit her, because she didn't understand that was what her problem was. She was confused for various reasons. So she was solving a problem to get off a list, but it wasn't really what her real problems were.
I mean, I think that just, for me, paints a picture of what we're getting wrong in public services, because we'll obsess with one aspect of someone's life, which is getting the children to school, and look at it through the lens of the child without thinking about the whole family, some of the issues they've got going on, and try to build a different relationship, as you did with people, so that trust builds and we can help each other. And again, that was at the heart of the deal, wasn't it? It's like a different way of working, a different social contract between citizen and state, and not trying to put people into those little boxes around the presenting problem. I mean, tell us about other places you work in that they're doing great stuff, Robin.
I think it's fair to say, particularly in the Northwest, although people talk about Wigan fatigue, which is fair, there's no doubt that the Wigan model has already taken place in other places to a greater or lesser extent. And certainly when I've gone in, particularly in the Northwest, to certain places, certain councils, I find that the starting point is not where we were in Wigan. The starting point is several steps ahead. One of the things, for example, that I think certain places in the Northwest have moved very quickly on is the whole idea of co-delivery of services in single places. Actually, surprisingly, although Wigan is there now, that wasn't one of the original things. If I look back at the process, so that thought needed to be come to, if you like. But certain places have been quicker off the mark on that front, and have set up this kind of place-based, locality-based working, which is not ideal yet, but it's certainly on the right path. Funnily enough, I think just getting people to work in the same places and talking to each other about the same kinds of people that they're seeing, often the same case that they're seeing, starts to spark a lot of what has been achieved in Wigan just organically on the ground. It's funny, but I think people intuitively knew that was the case, but seeing it put into action, you can see it as a really good driver. There's another place I'm working with in the Northeast that I think has another aspect of what was successful in Wigan in place already, and this is what I think is lacking elsewhere, which is that they have a label. And I know that seems really unimportant, but I remember really clearly in Wigan, we set off a lot of trains in motion at once, and I remember sitting in a meeting. And actually, you were holding an SMT meeting in another part of the building, and I remember sitting in the meeting going, we need to agree the terminology here, and we need a name for what we're doing. And the original name was the Robin model or something. I was like, no, we can't call it that. We can't call it that. And we went for lunch, and when we came back from lunch, someone came back into the meeting and said, I've just spoken to Donna. It's called the Deal. And that was it. So we called it the Deal, and we set out all those key principles and fixed the language so we all knew what we were talking about. And like I said, there's a place in the Northeast right now that I'm working with, which also has a good label, which everybody has bought into. It's a good title. All the local public service bodies are bought into it. And funnily enough, even though they haven't made as many changes on the ground as some of the places in the Northwest, actually, that's a pretty good part of the scaffolding, if we like. The fact that everybody knows what they're talking about and aiming towards is really, really important. I suspect change will happen quicker as a result, because they've stopped fighting over what it's going to be called and what it's trying to do.
Fascinating. Are you working with any NHS organisations, Robin? Because I do think this model and this different way of listening is so important, not just for councils, but for NHS organisations?
To some extent, not as much as I'd like, and partly because my knowledge of local authorities is far greater than my knowledge of the NHS. Structurally, I've certainly delivered training to people within the NHS, and of course working a lot with public health, which is the crossover point, where you have so lots of the staff that I've trained have been both NHS staff and local authority staff. But I agree with you, Donna, and certainly, the King's Fund wrote a really interesting write-up of the whole Wigan process, and I've been speaking to them about how this can be reversed, if you like, into the NHS. Well, one thing I think is interesting, though, is the relationship between a local authority and the NHS in any given location. Not always completely aligned, and that can affect how well you can do systemic transformation in a field like social care.
I think there is such a different culture in a lot of NHS organisations, isn't there, around, a very medicalised, individualised, interactive, transactional type model. And, I think the trust that I chair in Bolton, we're talking now about human-centred design and using anthropology. So I might be giving you a ring about doing some work with us in Bolton, because it's it's something that the NHS, there's more of a kind of heroic sense of, the medics know what's best for you, and you'll just get the treatment and that's it. So
I mean, it's interesting. Donna might point at me more than she should, and maybe I might do the same and point at Donna. I think when thinking about whole system transformation, actually senior leadership is the key. I think for me, in one sense, as a consultant coming from the outside of an organization, I can come and be an inspiration, if you like, and so can others, come with really good ideas. But actually, this is about senior leadership taking an interest, having the energy, and making decisions. And it's like I say, it's not just about signing off; it's about becoming involved and being part of the change that you're seeking to make. I sometimes say when I'm working with local authorities, if you're seeking to change a whole system and you come in and you do the same job that you did yesterday, then nothing has changed, right? You actually have to actively do that, and if the senior leaders are doing that, the rest will follow. I do believe that.
Yeah, I really agree with that. And I think Robin's just mentioned the King's Fund evaluation of the Wigan Deal, and it is really good. And they did an ethnographic piece, actually. They came to virtually live with us for a few months and speak to residents, and they got a really good overview of what was going on and what had made it work. And the two things that they said were different about Wigan to other places that they'd done evaluations of was, first one was kind of clarity of purpose, going back to that real simple overview of what are we trying to do together here, what will be different, and it's the how, how do you do it, not just what you do but how you do it. And then the second thing was so clarity of purpose. The second thing was constancy of purpose, that we were clear that this wasn't just something that was about me as chief exec or Peter Smith as leader or the political regime. It was about the place and the people in the place, and it's still going on because it was never about an individual. I work in places where you get a new chief exec, you get a new strategy, and it's got to be away from projects, away from ego-based strategy, and move towards a way forward with the people in the place together over a long period of time.
It was wondrous, actually, just to listen to the flow of the conversation and the expansiveness of the ideas, and just the way that you both there was so many things came to me from the language that you were using. I love the ethnography, Robin, and I really want to. It's so interesting because it's a space I've just started to go to think about in my new role because we're just trying to, how do you bring sort of in a world where you are prescribing people's behaviours and intentions all the time because you're in the world of harm and abuse and children and family justice, and it's all prescribed, and how do you bring yourself to a space of the not knowing, and the idea that you should try to work and recognize your assumptions and let go of your assumptions when you enter the space of connecting and relating to somebody. And how do you do that with judges and lawyers? How do you work with those groups of professionals and those in that system that is so much the other side, the other side of it, but then we know the system is not working well because it's doing that very thing, it's doing more harm by the way it is dealing with things. And so you're trying to bring an understanding to the narratives we're trying to tell about the justice system. And that's something I'm thinking about at the minute, because there's loads of powerful narratives about what is wrong with family or what is wrong with people or what is wrong with individuals. There's a whole kind of mobilization from a professional set of expertise, around that really is determining what's going to happen maybe in terms of what they perceive to be systems change or structural changes or behaviour changes. And they actually are all about restriction, Donna. Do you get me? They're all about actually restricting, pushing away, not thinking about need, but everything's as a problem rather than there being needs that aren't being understood because you're not in a space with people to kind of get it. Why do you end up here? How did I end up here? You don't even start there. You start with your problem of failure of what you should be doing as an individual or a family or a community. So it's been great for me just to listen to the two of you talking, because I know it's a very sort of different space, but it's the same thing. It's about people, and it's about relationships. It's about how systems of power, are really, wanting things to be different. There are so many beautiful people that I've met, those spark plugs, Donna, that you talk about, or those conversations. and it's trying to create space for that to emerge, I think, in our organisation, because we know we're just part of it, part of the journey, but it's trying to create a space of those people to come out of that system, you know, and find a way to connect and find a way to learn something new. So like your learning journey that you described around ethnography, you know, and the conversation and the scaffolding, it's like, well, you know, I think this is what we're trying to have as our intentionality, you know, with the statement that we don't really know. Do you get me? Because I keep saying to people, we don't know, we don't have answers, we're not an observatory that can give you answers. We can't do it, you know. It's about creating spaces for connection, you know, and then see what emerges, because we do know there are really interesting things happening in little pockets, you know, but they're all sort of in their little corner, and in a way they don't want to get found out because they may be told not to do it anymore, you know, or conversely. And one of the things I wanted to explore with you a little bit, Donna, was this idea of, you know, what's local and in the place, and then what's transferable elsewhere, and where the failure of that can be, you know, because there's a thing around people resisting other people doing it, because it's like, well, they did it because of where they are, we're in a different place. And that's kind of important to recognise your place, but it's also then this idea that you can just cut and paste and drop in, you know, without all the things you lot were just talking about, you two were just talking about, you know, around the mindset and the leadership and the kind of activity of leaders doing the training, you know, I think, you know, being present, you know, it's just, I really enjoyed it. Thank you so much. I worked on things like faith and trust and love. Those are the things that came to me in your conversation, you know, so those are the words I wrote down: faith, trust and love, you know.
You know, I'm so glad you said that, because I was on a seminar the other week about love, and it was all about how do you put love into public services. And I said, I always feel a bit weird when I say love in a meeting. People look at you like you're a bit mad. And, you know, so I know it sounds, sorry, I use your name in vain, Robin, and I talk about ethnography instead of love, because people start to go, oh, yes, ethnography. But when you say about human emotion and love and embedding love in public services, because you can't love someone if you don't listen to them. And, you know, I just think we've got so much to do, haven't we? Remodeling public services, so much.
I just wanted to say, I also wrote down trust on my list of things earlier. I'm fried in things. I just wanted to make a point, actually, Beverly, on your point about, you know, what can be cut and pasted, what can be moved over, and what can't. One of the other things I wrote down was that Wigan had a kind of humbleness, that no matter the specificities of Wigan, that there was no reason why Wigan couldn't do things. And I do sometimes encounter, when people are trying to make a change, often that's thrown back at me, oh yeah, but we're not like Wigan because this, and this. Nowhere is, everywhere is different, and, you know, nowhere is uniquely special. And I do think it's sometimes used as an excuse not to act. I mean, I live in Lambeth. This is Lambeth right behind me, one of the most diverse parts of the country. I don't think that means that Lambeth Council can't transform. And indeed, I would speak quite highly of them. I think they're quite good at it. But yeah, I don't think it should be used as an excuse.